Well, it is 6 o'clock in this evening on Labor Day, September 6th, 2021, Monday. And we're starting our Talk to the Doctor. And this is a forum where you can type in your questions in the chat box if you're on YouTube. And then I will go through the questions, and then we will try and give as best an answer as I can. We here at Tustin Longevity Center, and I'm Dr. Ella Thorpe, are 5 clinicians that work here in Southern California, Tustin, California, right next to Newport Beach. And we do integrative alternative medicine. We are looking to try and prevent disease and to extend a meaningful, vivacious life. And then from there go and have methods where we can address people who have already some disease or condition and try and offer to them integrative, alternative, complementary, functional medicine ways to improve their health. And we go from there. So it looks like maybe on a Labor Day that there aren't that many people in the chat room at the time. Maybe they're all having their barbecue. So I'm just going to talk for a few minutes. Today is the day that I do my 5-day fast, where I just do a water fast. I do this twice a year. And I always start it on the evening of Labor Day. And when I do that, I do everything I normally do. I come to work, I do my exercise, and so forth. And the reason why I do a prolonged fast, which I worked myself up to, I'm not suggesting, nor is any of this conversation designed to be personal, individual advice. You should see your doctor. Or if you are a patient here, come here. But this is for a general advice. And that is, I do this because fasting creates a time of cleansing and healing that no other therapy can do. If you reduce your gut's work, you're not using your digestive system, eventually your blood sugar is going to come down, ketones will come up, and this is not ketoacidosis, that is the dangerous form that is associated with insulin-dependent diabetes. But ketones are formed, and they're very much associated with a plethora of anti-aging, anti-disease phenomena. In addition to the ketones coming up, your gut starts healing in a more complete way. Leaky gut will heal. You'll start generating more human growth hormones so that your body heals, cuts, irritations in your body heal. You'll make brain-derived natriuretic factor, so your brain will heal if there's stress on your brain, and your mental clarity will become enhanced. Then you'll start burning fats. Fat burning is extremely valuable for life extension. There's just a ton of literature in the scientific community about life extension with fasting. During this time, I try to go to bed earlier for sure when I'm on the fast, because you heal at nighttime, and when you have more growth hormone, more brain-derived natriuretic factor, all these somatostatins working for you, they work best at night when you're at rest. You must drink plenty of water when you're on a fast, because as your body goes into what we call autophagy, autophagy is where your body eats up junk, aged, injured cells, potential early tumors or cancer, DNA damaged material, and it repurposes those components like in a demolition, and will take and save out bricks or certain things that are reusable. And so you drink plenty of water to clear it through. If you do a prolonged fast, you should work towards that. You should begin probably with, if you have any medical condition, the advice of your physician who can guide you if there's any problems. For instance, if you're an insulin dependent diabetic, you have to be on close supervision with your doctor, and very often we won't do any prolonged fasts with them. But if you're normally healthy, we usually start by doing what is called intermittent fasting, where you omit one meal a day. Usually it's breakfast, and then you only eat in a window of time, noon until 6 p.m., so that you get used to being without food for 18 hours every day of your life. Then once you can handle 18 hours without any food, then you try and skip lunch once a week or twice a week, so that you go from dinner to dinner. And then after that, if you can handle that, then some of the greatest fasting regenerative activity begins around the 36th hour into the second day. So I'm going to go 5 days, and we'll see how that goes. So I'm seeing some questions coming in now. And the first question is from Truth Through the Bible. Okay, I have a question. My daughter has thyroid troubles. She has nodules. She gets feelings off and on like her breathing bothers her. Could this be because of the thyroid? Well, there is such a thing as a goitrous thyroid, which has multiple nodules, and you would actually see the thyroid enlarged in a large way. And very often you can have a large goitrous thyroid and still not have any trouble with breathing. Nevertheless, it would depend on getting an ultrasound of the thyroid, seeing how big these nodules are, and if any look suspicious, you could do a fine needle biopsy. But in general, nodules are usually benign and often are just a result of aging. With aging, we can get autoimmune insults. Antibodies attack the tissues in your thyroid. You have the thyroid peroxidase antibodies and the thyroglobulin antibodies. So there's the matrix, and then the matrix, and then there's the cellular surrounding of that matrix of this gland. And so you can make antibodies to two of those components of the structure of the thyroid. And in the course of living, many of us may, even without knowing it, have some nodules. Iodine deficiency is very common. I would say about 96-97% of all Americans are iodine deficient. And I usually recommend iodine to all my patients. We find that this helps the function of the thyroid, because if there isn't enough iodine in the diet, then the gland itself is going to try and enlarge and create more tissue to capture iodine in the daily diet. The same for your breast tissue, the same for prostate tissue. These are glandular tissues in your body, like the breasts and the prostate, and they too are very dependent on having enough iodine for their specific metabolism in their tissues, whether it be the breast or the prostate. And you can find some enlargement due to iodine deficiencies. But most commonly is the excess carbohydrate, refined sugars, starches, refined carbohydrates, fructose that's in our, in our processed foods, that the insulin response to the starch sugars will stimulate growth as well. It's a very powerful growth promoting stimulant. So if you're eating a high carbohydrate, refined diet, and then you are iodine deficient and you're living life, you tend to get these fibrocystic breasts, benign prostatic hypertrophy, and you get nodules in your thyroid. So it's possible that it could be because of the thyroid. It's unlikely, especially if you don't see some big goitrous element. But go to your doctor, get an ultrasound of the thyroid done. Try and find a doctor that's familiar with functional medicine, integrative medicine, in addition to their standard medical training. We do a 24-hour iodine urine collection to see if you are iodine deficient. And sometimes when I just replace iodine in the diet, and I'm talking 12 and a half milligrams every day minimum. Some people need 25 milligrams. Some people need 50 milligrams because their iodine levels are so low. And then this will tend to improve their thyroid function, their whole body metabolism, even their mental acuity. Iodine is very important in the mental function of our bodies as well. And this often is very helpful with whether you have fibrocystic breasts, benign prostatic hypertrophy, thyroid nodules. But it should be evaluated. There are some ultrasound findings that do indicate that there may in fact be some abnormal cells in a kind of a nodule. But often the ultrasound will have parameters depending on the size, whether or not it should be biopsied. So that's what I would do, true through the Bible. Okay. Hopefully that helps you. D. Chrysler, if you can't recommend a vaccine, what do you recommend for prevention of the COVID virus, or should we get the virus? It looks as if I'm reading even today. I was heavily into the literature, listening to epidemiologists, infectious disease specialists. It looks as if we're long past the idea of herd immunity preventing others from getting it. It's likely that we'll all come exposed to this within time. And just like other viruses, the other common coronaviruses that make a cold, other viruses, syncytial virus, rhinoviruses that give a cold. And so there is so much, there's so much lack of transparency in what is actually in the vaccine vial, in addition to the proposed messenger RNA of the Moderna and the Pfizer, and the adenoviral vector of Johnson & Johnson, and then in Europe, that's called AstraZeneca. That's a DNA for the spike protein. There's so much lack of transparency. There is so much concern over their effectiveness, and you'll see arguments on both sides of the fence on the value of the vaccine. If there seems to be any consensus, it looks as if you do a vaccine, you might have a protection from less risk of death, less risk of hospitalization. But certainly it appears very clear the vaccinated can be reinfected, that they can, when they're symptomatic, transmit if they're coughing and sneezing and all that kind of stuff so much. So what we would suggest, as we've always suggested for the decades that I've been here, is that you live a healthy, immune supportive lifestyle, which is a low carb diet, because the American diet, the Western diet, is so full of purchased, marketed, processed foods that have hidden high fructose corn syrup in it. The other thing is the soda pop consumption, the juicing and the juices drinking. These are all very damaging and depressive to the immune system. As the sugar goes up, the immune phagocytosis and movement of your white blood cells to try and engulf invading pathogens is greatly diminished for many hours after consuming, say, a Coke or a glass of orange juice. So we first say be a low carb diet. We second say drink tons of water, half your weight every day in ounces. So if you're a 200-pound person, 100 ounces is what you should drink a day. To have the normal healthy lifestyles of washing your hands after going to the bathroom. And if indeed you have symptoms such as feeling achy, nasal congestion, starting to cough and sniffle and have runny nose, those have always been indications that you should excuse yourself from the public, whether it's in a classroom or at work or from your family, and go in your room, open the windows so you get a circulation, and take care of yourself and use things always. We've been promoting vitamin D. We usually recommend 5,000 international units of a quality D3. We mix ours with vitamin K2. Very often you'll need a higher dose, maybe for the first 5 days of the illness. We do have a 50,000 vitamin D that you take one a day for 5 days. Another thing that we recommend, and we put almost everyone on, is Juice Plus. That's our choice for the antioxidants, the polyphenols that are extremely well known and now proven in science to enhance the T cell and immune function. And there is news coming out that it appears the Nobel Prize this year is going to go to research in polyphenols, in which the Juice Plus Corporation has been in the forefront for the past nearly 30 years in promoting immune health. And we have millions of people who have done, particularly children, in the children's health study that showed they had less allergies, less sick days, less days missed of school, less days needed for going to the doctor, and better athletic performance, and even better academic performance. So vitamin D, a low-carb diet, plenty of water, a very good multi-nutrient. We use the Juice Plus, and then a multi-mineral called, ours here is called TLC Energy Core with a zinc in it, although there are other zinc supplementations that are very valuable. We also have quercetin. Now, I have bad allergies, and September is a humongous time for me to have allergies. And I normally take quercetin all of the year long. I never stop using DHIST. DHIST, 2 capsules gives you around 400 to 600 milligrams of a high quality company, orthomolecular quercetin. So this is what I would do for prevention. The other thing is, since there's such an thrombotic association with microclots that really cause the low oxygen with tiny little microclots that make it look like a filmy infiltrate on a CT or chest X-ray. This microclotting is from the spike protein at the ACE2 receptor, triggering platelet consumption. You can get the idiopathic thrombocytopenia and stuff like that. So we like to give a systemic enzyme also on an empty stomach preventatively, which will actually help if you had thyroid nodules, fibrocystic breasts, benign prostatic hypertrophy, joint pain, any inflammatory process in your body would normally use systemic enzymes to help break down the damaged tissue, the nodule, the cyst, whatever it is. So using enzymes, using Juice Plus, using a very high quality multi-mineral with zinc in it, using the quercetin in the DHIST, and being low carb and taking the extra vitamin C, vitamin D, not eating late at night, drinking the water. All these things have kept all my patients very well. We 5 clinicians here have really done nothing different than we've been doing for decades here at this clinic. and everyone has remained well. Everyone, I know of no one in our community here at Tustin Longevity Center who died, nor was hospitalized. So I have great confidence in preventive medicine. So hopefully that helps you, D. Chrysler, with what you should do, and that you can understand to give informed consent means that I have before me a physician desk reference of the studies and the constituents that go into a vaccine. And I don't have that. And with there being somewhere in the realm of between Europe and the United States, we're talking 30-some thousand deaths in the past 6-7 months, with millions of serious side effects. I have to pause and say I don't have enough information given to me to give informed consent to advise for the use of any of these gene therapies that they're calling vaccinations. Jennifer, is there anything in particular that we can do to improve the function of the thyroid? Well, Jennifer, I referred mostly to the question by truth through the Bible. With regard to iodine, since there's such a large volume of iodine deficiencies, I would say in many, many years, 10, 15 years or more, I might have seen one patient that just barely had enough iodine on their 24-hour urine. So your thyroid, the cell metabolism, is so connected and related to your thyroid function. If you're iodine deficient, you will have a diminished metabolic function, and that translates also to your immune system. So taking supplemental iodine is associated with better mental function and acuity and IQ performance and memory. It's associated with preventing breast cancer, ovarian, uterine, and prostate cancer. So I would definitely make sure that you're taking at least 12.5 milligrams once a day. Why do I say 12.5? The research on Japanese who have the highest national consumption of iodine are the Japanese over many, many years in research. And their average daily consumption is 12.5 milligrams. And then, of course, native Japanese women, up until recently, with marketing and consuming more and more processed foods, they have all had a dramatically lower prostate and breast cancer phenomena. So it's very normal to see even some of them eat as much as 50 milligrams of iodine in their diet in a day through their seaweeds and the various fish and seafood consumption. So hopefully that will help answer your question as far as particular things to do to improve thyroid function. Now, your blood type does make a difference. And if I've seen anything in 40 years of practicing medicine, what I've seen is the O type blood, whether it's O positive or O negative. I have seen them, in fact, be much more harmed by a genetic modification of the grain wheat and pasteurization, homogenization of the dairy. This manipulation alters the protein and sugar and fat structures in the milk and cheeses and so forth. And in the wheat grain, the genetic modified and glyphosated is altering the presentation of the proteins. And the immune system in the O-type blood seems to react to this worse. When that happens, there seems to be a switch or a cross confusion and attack of the thyroid. So if I'm going to see someone with a thyroiditis, an autoimmune thyroiditis, or even old evidence of it from a prior Hashimoto's or Graves', it's going to usually be in the O-type blood. Not that it can't occur in a B or an A or an AB, but it's the O's that seem to have the largest gut, leaky gut, micro-inflammatory injuries from these kind of manipulated foods and proteins that alarms the immune system, creates the cross-reference here. Now, if the cross-reference is to cartilage in your joints, the O's will tend to get the arthritis, osteoarthritis in particular. Very often you'll see psoriatic psoriasis. These are from the leaky gut. And so your blood type does make a difference too. All right, and then Jennifer goes on to say, and happy Labor Day. Thank you for being here for all of us. Where else would I be? D. Kessler asks also, with the Argentin 23 nasal spray, have you seen Herxheimer reactions? I am wanting to try it, but concerned about Herxheimer reaction. I have never seen that with the Argentin 23, and I've been using silver, colloidal silver, and then in the past maybe 15 years, I've exclusively gone to the nanoparticulate Argentin silver. And very often at the end of a day, I will squirt up my nose the Argentin silver to sterilize and clean out my exposure every day to patients that come in with colds or they were COVID positive. And then I will brush my teeth at night and then take a sip out of a jar. I have a jar, a little cap, and I'll take a little sip after I'm done brushing, and I'll swish, and then I will swallow it. But I have never seen a bad Herxheimer die-off of bad bacteria that makes people feel the flu-like achy symptoms from that rapid form of detoxing, killing off those pathogens. So the nasal, the oral hygiene, and then the studies, they've actually done some randomized control studies in countries that used iodine as a nasal rinse and a oral hygiene, and they found a great improvement against preventative for COVID. So that would be something else that D. Kessler, you asked, what else for prevention? You could do nasal rinses every night and an oral wash rinse. They even use the yellow color Listerine, these kind of oral swishes, but you spit that stuff out. And I would not rinse my nose with it, but even a normal saline rinse will help you expectorate any viral that has been breathed in and reduce any count of any of the viruses we're always seeing. But I found a very great benefit from the Argentin 23. There is in 2009 a Bethesda Naval, Maryland study you could look up on Ebola, and using the nanoparticulate silver killed it. So it's very good. And then someone typed something in Japanese, and I can't read this, so I'm so sorry to whoever did that. So I'm going to ask them to type it in English. Kessler asks also, I have EPI and wondered, is there any way to heal the pancreas? I also have Hashimoto's and wonder if they are connected somehow. D. Kessler, I don't recall the anachronism EPI. What does that stand for? EPI. Let me type that in and see if I can find it. EPI. No, I don't see anything jumping up with that as a diagnostic criteria. So you're going to have to type into me what that stands for, okay? Did you do that? No, I didn't see you do that. So you have EPI and wondered, is there a way to heal the pancreas? I also have Hashimoto's. Well, we're all similar, and metabolism cell to cell is similar. And the concept of autoimmune disease is similar in every blood type, every person. If you have Hashimoto's, you have apparently had some chronic consumption of something that was creating a micro-inflammatory trauma along your esophagus for decades, maybe. Food allergies. And then through those food allergies is leaking, exocrine pancreas insufficiency. Okay, exocrine pancreas insufficiency. And when that happens, then you can develop these antibodies, as I described before, that mistakenly perceive the thyroid tissue, whether it's the thyroglobulin production cells or the matrix TPO, thyroid peroxidase areas. And then you get this inflammation, and that gives you the hyper phase of Hashimoto's. Then that usually goes into a hypo phase. But we all have it. There's no one sitting in the world that doesn't have some degree of food reactivity with your gut lining wall. What you're hoping is that you heal it up. But if you have the same pattern of eating all the time, these problems, and the more genetic modified, the more processed your food, and then the higher the sugar, starch, high fructose corn syrup in the diet, you're going to put a stress on the pancreas. And that pancreas in a already inflamed body is going to have trouble from the Langerhans cells and the beta cells in the pancreas for making the insulin. So I would definitely, if I were seeing you, I would move to a low carbohydrate or no carbohydrate diet. You could probably get away with low carb vegetables such as broccoli, Brussels sprouts, asparagus, green beans, spinach, things like that, and kale, and use that with a rich, healthy, wild caught, fish, and prairie raised, grass-fed beef, and wild prairie raised poultry, and live very well doing that. So let me see where we're at here. So exocrine pancreatic insufficiency, and we can actually see their new cells and better activity. I have some insulin-dependent type 1 diabetics for years who, doing this diet over the years, have actually seen their islet cells and beta cells actually produce more insulin, and they were able to use less insulin, of course, from the healthier diet we put them on. So yeah, we can see improvement there. Damien says, hello, Dr. Ellithorpe. My husband, Ben, thanks you so much for seeing him this past Saturday. Yeah, we're here every Saturday. He's ready to make the lifestyle and dietary changes you suggested. Wonderful, wonderful. He's a wonderful person. His students need him to be strong, and he has so much to give to the community and his family and his students. So I'm so glad to hear he's doing that. Thank you for letting me know. Andre says, hello, which supplements would you recommend for an active 86-year-old who is after having an implant dental procedure this week and also has a pacemaker? I would get that Argentine silver, and I would, before you have the dental work, I would be brush, and then after brushing, I would take a sip of Argentine silver, swish, and then swallow it. And I would do that 3 times a day. So the bacterial, viral, fungal in your mouth is much reduced. And that'll make his implant more likely to be successful and have less inflammation and seal better. I would consider doing a high-dose vitamin C drip. We do this here. You don't necessarily have to be a patient. You can call in and say, I'm not a patient, but I would like a vitamin C. We do a 12.5 gram high-dose vitamin C for patients, and we do my nurse does a quick history and physical, and listens to your heart and lungs, your pulse and oxygen and all that. and then they will do that, and I'll review that, or one of us 5 healthcare providers here will sign it off. A high dose vitamin C is very valuable also in the collagen elastin for healing, for the implant to take it. And then after you have it done, I would also consider doing another vitamin C drip the next day, so that any secondary inflaming bacteria from all that dental work you want to heal up very nicely. And then, of course, I would be on a very, very low carbohydrate diet. Actually, if you could, I would go in fasting and would not eat. I would just drink chicken broth and beef broth, and do that if you're not an insulin-dependent diabetic and you can otherwise handle a 24-hour fast. So if you go into the dental event with a empty stomach, and after the event you try and stay on an empty stomach as long as is comfortable for you, all your growth hormone and repair somatostatins will help you get a better result. You also have to have a good vitamin D level to help fight infection and to have good bone formation. Vitamin D with K2 would be very important. In this time where there's so much concern about COVID-19, I would certainly be on a multivitamin mineral that has a good amount of zinc in it as well. We have this Immune Protect. Immune Protect, I put in it my best stuff, vitamin C, zinc, 25 milligrams, selenium, 200, arabinogalactans, olive leaf extract, astragalus extract, reishi mushroom powder, cordyceps extract, maitake mushroom, aloe vera, N-acetylcysteine, and quercetin. This is a powerful, powerful all immune support that I designed and had made. So that's a wonderful thing that you could do as well. So D, a good multi with zinc. I would certainly consider getting on Juice Plus as the antioxidant, anti-inflammatory benefits of the polyphenols. You know, I want to say something about the owner of Juice Plus, Mr. Martin. Mr. Martin was a teacher in North Carolina, and he first got involved entrepreneurially with the National Safety NSA Association, where there was, I think it was air filters and fire hydrants and stuff for the safety of the people's homes. And then eventually sold that off, and he went into Juice Plus after the water filtration as well. And Mr. Martin, Jay Martin, is, I would say, 88 years old right now. And his functionality is extremely wonderful. And I'm telling you, the people who I've had on Juice Plus for decades, I've been on it 23 years now, it just seems like aging slows down, and that goes along with all the research on polyphenols. So I would also suggest, Andre, that you consider going on Juice Plus, because it is truly a DNA damage proven with research, several studies, that Juice Plus reduces that damage. So that's another thing I would do. Think about the vitamin C IV before and after, the Argentin oral hygiene. There you go. And so Truth Through the Bible says, thanks so much. Okay, hopefully that helps you. Dolphin says, my husband got both jabs. Do I have to take drugs to protect myself? I would say no. Here is another example of the lack of transparency that is concerning to me as a doctor of 40 years. They have done the research on messenger RNA and DNA fragments for, it's really under the research if you look under gene therapy. And this was done with the original SARS when it originally came out around 2002. animal studies were done, and in 2015 and 2017, there are publications about shedding and the following up of people, the animals that had the enhanced antibody-dependent enhancement, which means the antibodies were actually not protective. When the natural exposure came around, the response of the immune system was such an explosion of cytokine storm that the animals, a large portion, if not all of them, died. But shedding was also reported. And with that, they haven't disclosed to us how much, what areas that we should look for. I do know that I heard some lectures from researchers that their safety studies are incomplete. They're not well organized and followed through on. So we do not have that adequately reported to us physicians, and that there is shedding. But I have to tell you, I'm here all the time. I've never missed a day of work from the past decades and decades. Basically, for the most part, I'm always healthy. Very rarely will I take a couple of days off to protect my patients if I were to come down symptomatic. And there is no asymptomatic spreading. That is a unicorn. I'll tell you about another unicorn, and that is the FDA approval that is allegedly for the Pfizer BioNTech is a unicorn because it's for the vaccine they call gene therapy vaccine called Comirnaty. Comirnaty is not available. You can't get that. It is not made yet. So all these millions and millions and millions of vials of vaccinations out there under Pfizer are still under the emergency use authorization, and that was extended, but no, they are not FDA approved. The Comirnaty is approved, and again, they're jumping through hoops. They have not done the safety studies that are required. They haven't used the board recommendations. They're making suggestions that the myocarditis, the cardiac impact of the vaccinations is something of concern, and they need studies into the years to come. But no, this is not an approved vaccination, and no one can require you to do anything to your body that you don't approve of, far less a emergency use authorization for a experimental vaccine. So should you protect yourself? Do you need to worry? I'm going to say, no, I haven't had any problems. And I'm around many, many patients who, I would say 20% of my patients have probably been vaccinated. And I really don't see any impact. Although I will admit with myself, I am a postmenopausal woman, of course, and I do use natural hormones. But in the past 3 months, my cycle flow has been more pronounced and a bit erratic. So I do associate that with shedding. But there you have it. So don't be afraid. I would take your quercetin, I would take your Vitalzyme or Vascuzyme, drink your water, be low carb, love your family, love your vaccinated friends and family. Do not shame them for having taken the vaccine. Support them with the same good preventative nutrition and so forth. Hopefully that helps you, Dolphin. D. Kessler says, thank you. Okay, Solaris 2510. Have you seen any patients or heard reports of having muscle loss and muscle fatigue while testing positive for COVID? Is it common with loss of smell and taste during COVID? Well, there is a physiological and biochemical pathway that can explain that happening. And this is being discussed discovered mostly in what they call the long haulers, those who have had the COVID from last year and they still have this persistent fatigue and persistent neurological issues, maybe foggy thinking, some with even the nosomia, which is that lack of smell or taste, coming back robustly. And we believe this is from the virus and the spike protein. That spike protein promotes micro-inflammothrombotic, little tiny microscopic clots. And that can affect your brain and then generate a fogginess in your brain. That can affect your muscles and the mitochondria. That can affect your whole body. So what I would suggest is using a systemic enzyme like we have the Vascuzyme or Vitalzyme twice a day, 3 or 4 or 5. I take 5 twice a day on an empty stomach. Now, I will say, of all my patients who have taken the gene therapy jab, that my patients have not had any symptomology from this for the most part. And I think that's because of all the wonderful preventative things that all these things do for us, the low carb, the water, the enzymes, the vitamin D, the quercetin. All this promotes health, no matter what the situation is you're fighting. So I would say to you that this muscle fatigue, this loss of smell, this is from the inflammothrombotic microclotting. So enzymes should help dissolve this away. And then EDTA chelation therapy is a very smart thing to do. And again, you don't have to be a patient here to get our EDTA chelation. You could call our office or find a doctor in your area, acam.org, that would do EDTA chelation therapy. Is a amino acid that grabs onto heavy metal toxins, but those heavy metals are all cations, and EDTA is a anion, and so cations have a positive charge, and the spike protein has been described in other literature as having a positive charge, so that the EDTA is now associated with improving the microcirculation everywhere over the body. Long before COVID, this was understood to help microcirculation everywhere. And so if you don't eat a high carb diet and clog up all the vessels, if you do some chelation, if you take the systemic enzymes regularly, I would definitely use Juice Plus, the antioxidant. Again, the research on it for the polyphenols is probably getting the Nobel Prize this year, is what I've heard. And go from that point, keep your vitamin D level up. And then if you do the FLCC.com, you'll see on their protocol that there is what is called a long haulers protocol. I don't have it right in front of me, but there are those that would suggest that you should be on ivermectin over a prolonged period of time, or hydroxychloroquine, and so forth. So hopefully that helps you, Solaris 2510. D. Kressler says, oh, that was you telling me exocrine pancreas insufficiency. Okay. Dan Dres, what is a good way to get rid of parasites, namely malarial parasites? Thanks. Well, there, of course, everyone's talking about ivermectin, which is a Nobel Prize winning discovery that was awarded in 2015 to the founder of it from Japan. It has been used for about 40 years. The World Health Organization recognized it as one of the most beneficial medicines found for humanity. So ivermectin is very good. Now, if you're not going to use ivermectin for malaria, quinine, there's the hydroxychloroquine series. Then there are supplements that have antiparasitic. And what is that? That is, here it is. So we have oregano oil. What's the other one? Thyme oil, clove oil, pau d'orco, oregano leaf. There are various caprylic acid. These are herbs that are well associated with well associated, and this again is from Orthomolecular. I well researched herbs that are tested so that they're not contaminated with other things in it. That's a problem with over the counter. You can look for caprylic acid or oregano or thyme or things like this, but they're from sources that are not vetted in a high quality standardization, and many of them have toxic heavy metals with them. So you have to be very careful, and this is one of the things we do for our patients. So hopefully that helps you, Dan Driz. What is a good way to get rid of parasites, namely malarial parasite? Thanks, and there you have it. Dolphin, my husband got both Moderna shots. Do I need help to protect myself? Well, that's similar to the other question, and I think I answered it. All the things that you're doing, the quercetin, the D, the enzymes systemically, you could do EDTA chelation therapy, all that will protect you, and you should do quite well. Karen D. Hi, Dr. E. What do you think about the Novavax vaccine that will be coming out? Novavax is reportedly more of your traditional true vaccine, where they take the coronavirus and kill it or attenuate it, and those fragments of the entire viral particle, along with its spikes and everything, are in the vaccination. And there is no seizing of your own genetic reproduction in your cells to produce this through gene manipulation. So gene therapy. So it seems to have more of a traditional true vaccine history, and it would be more of what I would be familiar with for 40 years. Andre, what is your opinion of a mouth rinse using tea tree oil, 50% water soluble, and sea salt for healthy gums? Tea tree oil is a very pungent extract, and I'm not sure if anybody could do that on a regular basis in their mouth. We put that on toenails sometimes for toenail fungus. So I'm not going to recommend it because I haven't seen anyone do that. But I do know that it would be a antiviral, antibacterial, fungistatic extract that does have benefit. So I'm not going to recommend that you do it, though. I would use Argentin 23. That'll cover it just as well. Okay, so Solaris 2510, thank you. Dandris, thank you. Karen D, thank you. Jennifer, for a friend, what are some of the things that can be recommended for Parkinson's patients? Does EDTA chelation help? Yes, absolutely. My friend's mother is nearing 90. Is chelation generally safe for the elderly? Absolutely it is. I have been around EDTA chelation since I was 7 years old. That's 61 or 2 years ago. I have been around it from the inception almost of the doctors in Michigan, the cardiologists that started seeing the serendipitous benefits of it on their men who had ischemic heart disease and hypertension, cardiovascular problems. These were older men, and then from there it went on to be promoted by the Great Lakes Academy for the Advancement of Medicine, and then that turned into the American College for the Advancement of Medicine, acam.org, which is now, and I teach chelation therapy for them to young doctors or any doctor that's interested. And I have used, there are no age restrictions. It would definitely help extend the circulation from the brain to the toe of any human being who does this. And it certainly seems valuable in COVID-19 with the inflammatory thrombotic little microclots, especially if you're taking systemic enzymes. So I would definitely do that. Parkinson's, the substantia nigra in the center stem of the brain is associated with a demyelination of that area. And that is felt to be from oxidative stress. We don't know the cause of Parkinson's, but again, I think it's that oxidative stress. So antioxidants like Juice Plus, chelation therapy, systemic enzymes, all those things would be very beneficial to everyone and all diseases. Garden Fairy, that's a nice name, Garden Fairy 351. My 85-year-old mom has had irritable bowel syndrome issues for many years, but the last 3 months more severe urgency, so that she's afraid to leave the house, especially the first part of the day. Well, I would definitely try and get her to a doctor, a functional doctor. You would want to know whether or not she needs a colonoscopy, or if she's having any trouble with, we want to rule out the worst, cancers and stuff. But in general, irritable bowel, her probiotics would be valuable, using SBI Protect powder along with Orthospore IG. This probiotic is clearly studied in inflammatory bowel syndrome to reduce these episodes. So Orthospore IG is by Orthomolecular. We have it here. 2 a day, I think, would be the minimum. That was used in the research on it. And then SBI Protect, also by Orthomolecular, has the immunoglobulins that are so protective. And then I would put your mother on a elimination diet where I would restrict her to a protein and a vegetable, and the only condiments would be like butter, salt. I don't think I would even use pepper. And I would have meat with, let's say, broccoli, salted and buttered for both lunch and dinner. Or any of her meals. And then the next day I would change it to chicken and green beans for all her meals. And then the next day, salmon and asparagus for all her meals. And the next day, maybe pork roast or pork chops and spinach for all her meals. So that gets her down to only 4 different proteins and 4 different types of vegetable with only butter and salt as condiments. And then I very often with that start people off with a 36-hour fast where they just take chicken broth or beef broth just to give their gut a total rest. If she's hungry, I would often give someone some ginger ale, the real ginger ale that has the sugar in it, and then mix it about 1/3 water to 2/3 ginger ale. So her gut is just seeing the salts and minerals of chicken broth, beef broth, and the sugar and ginger herb is calming to the gut. That'll help rest her gut. And then if you get Orthospore IG and SBI Protect, and you mix that powder of the SBI Protect in water, and you do that twice a day and take the Orthospore IG, and I have just great results with this on anybody, no matter their age. So maybe something like that. Get it, find a doctor, come here, see us. And we do have these things, but most well-rounded functional doctors, alternative doctors can help with that. Let's see. Oh, Kathy G. I have a BRCA2 gene and am on 2 infusions for carbol and taxane for 8 more weeks. 61 years old. Eat healthy, stay healthy. Found you through another person because, let's see, I think this goes on. another person with breast cancer. Well, praise God that you have an oncologist, you're under treatment, you're trying to do very healthy things. But Kathy, I think you would do very well. We have many patients who we come alongside the oncologist. We don't treat cancers or suggest that we treat cancer at all. What we do say is we build up your immune system and we help detoxify you because there is the argument that originally in the 1910 or so is when radiation treatments came, and then surgeries, and then chemotherapies started in the 40s, 50s, and then multiple therapies started in the 80s and 90s, and then gene therapy, thinking it was a genetic disorder, developed. And then of late, because their gene theory that cancer is caused by genetic problems as a solo cause is not panning out. And what they're finding is when they actually do these tumors and they look at many types of cancers and they do a gene assessment, they're finding 100 genes are mutated. And a person with the same kind of cancer that looks the same, let's say a colon cancer, has a different set of genes that are mutated. And so they have to ask the question, we can't develop a chemotherapy, gene therapy just for 100 here and then a different 100 over here. So there's something else going on, and that something else is, we believe, the facultative, fermentative, anaerobic respiration of genes that is brought on with chronic stress and inflammation of some sort over the years. And that chronic irritation that is what flips the gene into its expression. If you had the gene, it's probably been there since your birth. Maybe your parent had it. So we talk about all the therapies I'm bringing up: low carb, EDTA chelation, high dose vitamin C. All these things are associated with starving the cancer cells so that they succumb, because they have to have so much more consumption of glucose than a healthy cell. So if you started to do fasting, if you read Walter Longo's research from San Diego, if you put LONGO in the computer and you look up fasting with chemotherapy enhances survivability and effectiveness of the treatment, something to that effect, because they found people who go into their infusions of chemotherapy, if they are fasted, whether it's radiation therapy, chemotherapy, the surgery to debulk it, they found fasting people that the blood sugar drops, all your healthy cells can handle it fine, but those cancer cells are very dependent on a constant consumption of sugar for survivability and rapid growth. Now, the PET scan, the proton and emission scan is dependent on linking sugar to a tracer that when it's given to you, those little cancer cells will eat it up first and then fluoresce. And this is how we see whether cancer is in the body. So that we're right and have always been right, that cancer survives on sugar. It hates oxygen. So if we improve your microcirculation, if we bring your carbohydrate starches down and insulin down, because insulin is a growth promoter of tumors, and if we use high-dose vitamin C, you can look up Rhonda Patrick, Patrick, I think. Rhonda Patrick, PhD. She's also in Southern California, and she's very aware of these things, but she has an entire volume on all the anti-cancer effects of high-dose intravenous vitamin C, because if you went right into the vein, you could never take enough vitamin C orally without getting all this diarrhea, but we can bypass that right into the vein, and I think it has shown every stem cell of any cancer ever known has been killed with high-dose vitamin C, and that's based on very well-known biochemistry. The enzyme of the cell, any healthy cell, has this enzyme called catalase, CATALASE, catalase enzyme. But cancer cells don't have this. So vitamin C is processed, and who have not been diagnosed with cancer, if we do it occasionally, we're killing off stem cells. And so that would be something you might consider. So we have been doing this for decades and decades. And if you go on the YouTube and look up IV vitamin C, and the name of this is Curing Cancer and Infections by Thomas Levy. He's both a doctor and a lawyer. Thomas Levy, Levy, MD. It's a YouTube, and there's many others. The Reardon Clinic has done this for decades. I've been doing it for decades. It really produces better outcomes when we work with those that are undergoing chemotherapy. Now, if your oncologist is not aware of this, high-dose vitamin C is a pro-oxidant, and chemotherapy is an oxidative stress for the cells. So in no way is high-dose vitamin C an antioxidant, and very often they don't have this nutritional education, and they'll say, don't do vitamin C therapy. But they don't understand biochemistry enough because they weren't trained in it. And so high-dose vitamin C is pro-oxidative, and it is literally killing, selecting out cancer and cancer stem cells, whereas your body natural cells that are healthy still are not affected at all. So look that up. Rhonda Patrick, all of our studies on vitamin C, plus a plethora of many other things. And then look up Dr. Thomas Levy, and I think that'll bless you greatly. All right. You're at City of Hope where you're at. Well, wonderful. They should know a lot about it. I think City of Hope has a lot of informed oncologists there that do know of the pro-oxidative benefits of vitamin C intravenously. And the Walter, VAL, not W, VAL, Walter Longo is the PhD who did all the research that's most internationally renowned on the low-carb diet, ketogenic, carnivore type diet associated with tumor regression and restoration of health. So hopefully that helps you. Well, my dear people, and I know some of you are my patients, what a joy it is to have this source to meet together and talk about this. It looks like one last question came in. Dan Driss, how would you try to increase recovery rate of a possible Advil allergic reaction, a severe one lasting weeks long? Advil is an anti-inflammatory, and it is a COX inhibitor. You know, what I would do is I would use enzymes because you've had a lot of cell membrane damage. And I would go on a clear liquid diet for any disease. This isn't just Advil allergies or anything like this. Anytime you've had an assault, if you fast, the body knows how to heal itself. And if you don't eat anything for, let's say, 2 days, but you just drink chicken broth, beef broth, and water, your body, and take systemic enzymes to clean away the debris, you should see a tremendous benefit. Then when you start to eat, I would consume a fat protein richer diet and stay away from the vegetables for a day or two, because all the cell membranes are made up of fat and protein. So you want to enhance your repair venue. And so that's probably what I would do looking at that. So hopefully that's a a concept of cleansing and will help you dandruff. But of course, if you have any severe, you say it's going on weeks long, so you probably are not having any anaphylactic wheezing, shortness of breath, but you should see your doctor to help you as well. All right. Damien, thank you for sharing your time and knowledge with us. Thank you very much. Love and blessings to you, Damien, and to everyone. So I'll wrap up here and have a little bit of time left for a holiday. Work tomorrow and work today all day. But praise God, I'm glad to be healthy, and there's nothing worth more to me than taking care of my loved ones and my family and my patients. So God bless. And Wednesday morning, 9:45, we have a half hour of this. You can type in questions to office at tlcdoctors.com, office at tlcdoctors.com, in case you don't have time to get in, and we'll read it out, and then you can come back and look it up as well. Remember to like and share. Please put a comment. This will all help our ability to reach more and more people. And so God bless and happy Labor Day, everyone.